Hi, my name is Sheena Santos. My colleagues and I would like to present to you a topic from our Healthy People 2020 database. We would like to discuss dementias, including Alzheimer's disease. Coming from a background in long-term care, I've had a chance to witness firsthand the effects that dementia and Alzheimer's can have on the population 65 years of age and older. As nurses, we can invoke change by working towards reducing the proportion of preventable hospitalizations in adults aged 65 years and older with diagnosed Alzheimer's disease and other dementias. Let's take a look at what dementia is. Dementia is a term used to describe a cluster of symptoms. It is not a disease in and of itself, which is a common misconception. Dementia is an umbrella term used to describe a group of diseases that cause progressive loss of brain tissue that will eventually affect a person's perceptions, emotions, behaviors, memory, and thinking. People living with dementia are at a greater risk for general disability and more frequent falls. Older adults with dementia are 3 times more likely to have preventable hospitalizations. As their dementia worsens, people need more medical and supportive services and oftentimes need long-term care. These challenges can exact an emotional, physical, and financial toll on their families, caregivers, and society. Because it's a progressive disease, dementia can often lead to diminished or decreased abilities to avoid physical injury, maintain social relationships, carry out activities of daily living, such as bathing or dressing, manage medications and medical conditions, make financial decisions, and drive a car or use appliances and tools safely. Nurses to the rescue. Nurses can implement many strategies to help meet the goal of reducing the proportion of preventable hospitalizations. Our main strategy is through education and communication. Today, we want to educate you on ways to reduce hospitalizations by preventing urinary tract infections, preventing medication errors, and preventing falls.
Dementia patients are at risk for urinary tract infections as a result of inadequate fluid intake, urinary retention, poor or infrequent personal hygiene, infrequent changing of undergarments. What should nurses look out for? Look for signs of increasing confusion. For example, if the client could complete a task the day prior but is not able to complete the same task today. If the patient is demonstrating an increase in fatigue. Cloudy or foul-smelling urine, bright pink or tea-colored urine, which may indicate blood in the urine. In male patients, a feeling of fullness in the rectum. What are some potential complications of UTIs? Because of changes in perception, dementia patients with a urinary tract infection may not report any pain. Instead of pain, the urinary tract infection may manifest as increased confusion, agitation, or withdrawal. Keep in mind that a slight increase in confusion may be masked by pre-existing dementia. Left untreated, a urinary tract infection in an elderly patient may lead to pyelonephritis and even sepsis. What nursing interventions can help to prevent urinary tract infections? Encourage the patient to drink 6 to 8 glasses of water per day. Prompt the patient to void every 2 to 3 hours or create a bathroom schedule. Ensure adequate hygiene, washing, frequent changing of undergarments, and in female patients, wiping front to back. Some of the medications used to treat urinary tract infections can increase confusion, lead to dizziness, exacerbate the effects of orthostatic hypotension, and even lead to seizures.
Medication errors are the biggest reason why patients with dementia, including Alzheimer's, end up in the hospital. Elderly patients with a psychiatric disorder, such as dementia and Alzheimer's, have the lowest medication adherence. Medication adherence alone led to $198 billion in hospital costs in 2010. However, additional medical costs associated with the non-adherence was over $300 billion. Medication adherence is a patient behavior that is harmonious to the healthcare provider's recommendation for timing, dose, and frequency for a medication. Common risk factors for medication non-adherence include polypharmacy, the use of multiple drugs to treat a single medical condition, complex treatment regimen, a difficult yet structured plan to treat an illness, cognitive, memory, and physical deficits, the loss of perception, sensation, thought process, physical ability, and mental aptitude. And finally, lack of social support, the loss of feeling cared for, being part of a network or system, or obtaining assistance from others. Clearly, the woman in the picture is overwhelmed by the plethora of medications she needs to take. Certain patient characteristics can affect the ability or desire for patients to take their medications. As nurses, we need to be assessing for these psychosocial and behavioral characteristics, such as cultural and religious barriers, a sense of mistrust of medications or negative beliefs about medications, a belief that a prescribed medication is ineffective, the perception that medications are no longer needed when symptoms resolve, depression and other psychiatric disorders, dementia, memory, or other cognitive impairments, lack of confidence or self-efficacy to manage medications, physical impairments such as arthritis or impaired vision. Medication adherence leads physicians to increase doses or add medications. Studies have shown 3 or more medications among the elderly significantly decreases medication adherence. So, imagine what happens when a patient with dementia is asked to take their hypertension medication 2 times a day, their arthritis medication once a day, their cholesterol medication once at night, and their UTI medication for 10 days. Now that we know what polypharmacy is, what can nurses do as an intervention? Prescription cascade refers to the process where the side effects of drugs are misdiagnosed as symptoms of another problem, resulting in further prescriptions and additional side effects and unanticipated drug interactions. This may lead to more misdiagnoses and symptoms. Encourage the patient to use one pharmacy. Reviewing and reconciling medication lists creates a more complete and accurate list. This list of patient medications can then be compared to those in the patient's record or their medication orders. To help with the forgetfulness that our patients usually have, we can provide our patients with a pill organizer or reminders, teach them how to link their medication regimen to daily habits such as brushing their teeth and taking their hypertension medication, or watching the evening news and taking their Coumadin. Visual and audible aids have also been shown to be helpful. Patients with dementias, including Alzheimer's, will have a complexity of medications. Helping them to adhere to the aids we provide them, such as pill boxes, calendars, and reminders, can help. Combining their medications to simplify can also decrease confusion. Decreasing the frequency of the medication regimen by speaking with the patient's healthcare provider will also help. And again, promoting the association between a patient's routine and their medication can also help with decreasing the complexity of the medications. Effective, sustainable solutions to improve adherence and persistence with medication regimens require multifaceted and complex interventions, including combinations to increase convenience of care, effective patient education, a patient-provider relationship that integrates patient-centered education, counseling, reminder systems, routine follow-up, regular feedback, and supportive care.
I've fallen and I can't get up.
Another factor that increases hospitalization for people with Alzheimer and other types of dementia is falls. This is a general and non-modifiable and modifiable risk factor for falls. If we look at patients with Alzheimer and other types of dementia, they would display almost all of these risk factors. This is why it is important to nurses to understand the importance for ongoing assessments. During this presentation, 4 major factors will be discussed. People with dementia suffer from memory loss and impaired judgment. The surroundings may appear foreign to them, so avoid rapid environmental changes. They have poor judgment and they do not realize or are unaware of environmental dangers. They may unknowingly put themselves in a hazardous situation that a cognitively intact person would not do. So modify the environment plays a big role to prevent fall. As you see here, there are some of the interventions that can assist to reduce the hazards around the house or even the long-term care places, like removing loose rugs, proper lighting, trip hazards, handrails, bath-safe handlebars, furniture arrangements, and floors that are too slick, and changes in flooring types or levels. These all play in a big role to decrease the environment hazards and prevent falls. Medication like benzodiazepines, anticholinergics, opioids, antidepressants, and neuroleptics are linked to falls. Constant reassessment is necessary not only for determine effectiveness of the medications, as well to detect the side effects of the medications and how they play increases for fall. Orthostatic hypotension, which is a drop in blood pressure when a person goes from a lie position to a standing position, can occur in up to 30% of older adults. Some people exhibit no symptoms from this change in blood pressure, but others can become lightheaded and unstable when this occurs, and this can lead to a fall. These are the most common side effects that increase the risk for falls. Like we see here, the most common is syncope, orthostatic hypotension, mental confusion and agitation, hallucinations and delusions, and also aggressive behavior. Proprioception is the sense that tells us our body's position in space. It is also essential for balance, posture, and movement, and becomes less effective with age, along with the decrease in muscle tone and strength. All this can lead to the inability to avoid a fall after an unexpected trip or slip, and can contribute to the person falling. In general, older people do not pick their feet up as high, which increases the tendency to trip. They also develop changes in the way they walk. Older men develop a wide short step, and older women narrow widening steps. With the progression of the disease, patients are most prone to falls because they actually forget how to walk. They may have strength in the legs, but they lose the ability to coordinate the trunk and the legs. Some of these, like you see here, they are tools that can be used to minimize the physical inability that come with age and also with the progression of the disease. Like use of ambulatory devices, gait shoes, vision aids, hearing aids, hip protectors, and also to maintain patients active. They all reduce their risk for falls. Assessing patient cognitive status and deterioration are the first step. Patients with dementia and Alzheimer's lose the ability to make complex decisions. However, small decisions will give them the sense of some control. This is some of the simple interventions that can use to assess and also assist your patient with his cognitive change. Assess if patients are oriented to their abilities and or overestimate their abilities. Familiarize the patients with the environment. Empower patients to make decisions based on their cognitive abilities, and supervise activities to maintain safety, but also allow independence.
The overachieving goals of Healthy People 2020 are to attain high quality, longer lives free of preventable disease, disability, injury, and premature death. Also, to achieve health equity, eliminate disparities, and improve the health of all groups. We, as nurses, interacting closely with the public, are on the forefront of promoting Healthy People 2020. Nurses have a duty to educate not just our patients, but our colleagues as well on ways to institute change to promote better health for years to come. We are not just making changes for those who will come after us, but for those who have come before us as well. Like our elders, for instance. We need to constantly respect our elders, especially those that have and will become plagued with dementias, including Alzheimer's, by helping to reduce and prevent hospitalizations due to UTIs, medications, and falls.
Only you can reduce the proportion of preventable hospitalizations in adults 65 years and older with diagnosed Alzheimer's disease and other dementias.